Hey everybody, welcome to Mission Fitness, and we are continuing our series on survivors. And today we have a very special guest with us. He is a master colorist, hairstylist, and a certified Zumba instructor, and a good friend of mine, Charlie Guzman. Hey man, thanks for joining us.
Hey, how are you?
I'm doing fine.
Thank you.
So first question, right off the bat. What do you think of my hair?
Hey, it looks great.
Yeah.
I mean, come on. I did it.
He did it. Yep. For like 15 years now, he's the best. Anyway, okay, so today we're talking about something a little more serious, lung cancer. You've survived it. When did you first find out that you had it?
Well, the surgery was done in 2018 of March.
Okay, so we're just
2018.
a little over 2 years.
Right. And
So tell us how it started. How did you find it? How did you figure it out?
getting in my car, I would be driving and I'd have this pain in on my right side, in my rib cage, and I went to the doctor for a cold actually, and she said, "Is there anything else that's bothering you?"
Now, this is your primary care?
Yes. And I said, now that you mentioned it, there is this little problem right here that I was wondering if maybe I might have broke a rib or something. And she said, well, I don't know. Let's take an x-ray. So she sent me to go get x-rays, and lo and behold, there was a carbon spot on the left side. And
It wasn't even on the side that you were having the pain.
no, it was not. And so with that, they did a biopsy and found that it was cancer in the lower left lobe.
So it was really a good thing that you didn't do what a lot of people do and say, oh, maybe it'll go away. You actually, and it's a good thing she asked too. Had she not asked, would you have said something?
No, I wouldn't have. I wouldn't have. In fact, I almost was gonna just ignore it. But I thought, she brought it up, so why not mention it? And thank God that she was so inquisitive about,
Yeah, I mean, there's a lesson there, because I know especially with men, we were talking about this, in a couple of the other segments, that a lot of times men, I don't want to say anything because they're going to think I'm not a man enough to handle it, or, suck it up, buttercup, that kind of thing. But no, so you decided to say something. It's a good thing. Okay, so what happened then after you did the biopsy?
So the gentleman that was releasing me said, I've done many of these. I took a look at yours, and I don't think you have anything to worry about. So I went home with the mindset of thinking everything was cool. I don't have anything to worry about. And with that, when I went to get my results, I didn't ask anybody to come with me because I knew I was good.
Yeah.
And man, talk about hit you like a ton of bricks. Because when he walked in and said, okay, so did anybody talk to you about your results yet? And I said, no, sir, but I kind of know it's all right. And he said, no, it's not. You have cancer. And that C word, boom, hits you like a ton of bricks.
It does.
Yeah.
It does. Yeah, because it can happen to someone else, but it can't happen to me.
Correct.
But then when you hear it, I mean, what went through your head the first time you heard it? I mean, what did you think of?
Well, I said, I froze and I thought, so what does this mean? And he said, well, do you have any questions for me? And I said, well, I don't know. What do people ask you?
Yeah.
And he said, well, one thing they want to know, am I going to die? And I said, well, okay, that's good. Am I going to die? And he said, no, this can be fixed with surgery. And so he sent me to the surgeon, and he set me up to have my bottom left lobe. You have 3 lobes on the left side, 2 on the right. The bottom left lobe was removed along with 12 lymph nodes.
Okay. So they removed it, and then what was the recovery like?
Well, it's similar to an open heart surgery. So they cut you in the back, and they break ribs, and they don't tell you all this.
Okay.
So
So you didn't know until you got out of surgery that they had to crack ribs to get to what they needed to get to?
well, actually, the appointment afterwards, and I said, you know, my ribs are hurting really bad. Did you break anything in there? Kidding. And he said, yeah, we broke a few. We had to get to the lung. And I thought, wow.
Now, do you wish they would have told you that beforehand, or less is more?
Yeah. Less is
Ignorance
more.
is bliss, yeah.
Absolutely.
Yeah.
And you know, they have the surgery online that you can watch, but I didn't want to watch it.
I made that mistake.
No, I didn't want to
I made
do
that mistake. Yeah, no. That was, then it puts it in your mind.
Well, you're getting ready to go into surgery, and you're thinking everything they're going to do to you. No, I didn't want to know.
Well, and then given that you didn't even have time to mentally prepare yourself for it, because for 2 weeks, you thought everything was okay.
Right.
And then you were blindsided, right?
Right.
Okay, so did you need treatment after that?
No, none at all. Everything was cleared. And I have to go once a year to get a CAT scan so he can read it, check it out, and make sure everything's cool.
Now, that'll be forever, or that's after 5 years you don't have to do it anymore?
I would imagine that's forever. I would hope so, because I want to stay on top of it anyway.
Now, the CAT scan, do you have to drink the barium, or is it just it's the injection, or any contrast? Or
No, I don't think it's even the contrast.
Okay,
It's
okay.
just
similar to an MRI. You just go in.
right. You
and
go
scan
in,
it.
it goes around. It's like 15 minutes, and then you're finished.
So, what is your advice to people who maybe just found out that they had it, or they're not sure, or what would you tell them?
Early detection is the key. If you keep on top of going to the doctor, regular doctor visits, and any little thing that's bothering you, don't be afraid to ask the doctor.
Yeah, that's the big thing. Right.
Come right out and ask them.
They want you to ask them, because then if you don't, then what they may have to tell you weeks or months from there may be a lot worse than they're going to tell you right there in that day.
Absolutely.
So, so taking that a step further, now did you smoked, right?
Yes, I did.
But you had quit a long time.
For 10 years.
For 10 years.
In fact, the day of the surgery was my 10-year anniversary.
So this is that's a pretty good lesson right there, that even if you have never smoked, or you stop smoking and your lungs have cleared for the most part, you can still get it. But I mean, they can't trace how you got it, right?
No.
And it's not hereditary, it just...
No.
Okay. All right, so what about, you are a Zumba instructor. Did that affect, obviously you wouldn't be able to teach for a little bit, but are you back now? How long did it take?
Well, I will tell you that being a Zumba instructor has helped my recovery through this surgery, because I was in physically fit condition to be able to do things. Pull yourself up, because you got to realize that the ribs are broken. So I was able to pull myself up a lot sooner than most people that couldn't.
Because you don't realize how much you need those muscles until you don't have them, right?
Yes.
What was one particular thing? Was it going to the restroom? Was it getting out of bed? What's the hardest thing?
Actually laying in the bed. I had to get a recliner, an electric recliner, because just to sit up in bed, to get out of bed, to go to the bathroom, was a task to sit up in bed. So rather than have to use all their muscles, I just got the recliner, and it sat me up, and I was able to get up and go.
Yeah, it's kind of amazing, because I had a doctor friend tell me that a lot of times it's not the actual surgery itself that they're fixing, it's how they have to get to it that tears the muscles, and that's where a lot of the recovery comes from. And this is a classic example of that.
I still feel numbness in the rib cage and soreness.
Did they say how long that'll last?
He said that they cut through a lot of nerve connectors, and sometimes they'll connect back, and sometimes they don't.
So you'll have numbness.
So you'll have numbness. Yeah.
So are you Are you back at Zumba? I mean, I know there's another reason, we'll get to that in a second, of why you might not be because of your knee.
Right.
I mean, you had a torn meniscus, right?
Yes, yes. And, but I'm 3 weeks out of, 6 weeks out of Zumba. And I started teaching little by little. So I had a substitute. And I would do a little bit, 1 or 2 songs, and she would take over the rest. And I prepared myself to work myself back up to doing a full hour class.
So did you find it helped? Did your knee feel better after you, when you would start teaching the Zumba classes after the surgery? Like to loosen it up, like when you said when you started a little bit at a time?
No, that was after my
that was
lung.
after your lung. Okay.
I haven't.
Oh, you haven't started this yet?
I'm still
Okay.
under doctor's orders.
So how long will it be for that?
He said 10 weeks, but I'm into my 8th week now.
Okay, so you're getting close.
I just started physical therapy today. And he told me he don't see me being there very long because I've already surpassed where I'm supposed to be. So
because you've been moving
crossing my
around.
fingers.
I mean, you've been back at work, and you know, so and that helps, right? I mean, as
3
opposed
days.
to sitting.
Right.
Lying. A lot of people
Oh,
after
yeah.
the surgery, they just want to lie on their back, and that's the worst thing you can do.
And movement. That's why in the hospital, as soon as you get surgery, they come and get you the next day or the same day and get you to walk around.
Right.
Because they want you to move. Movement is the key. I do a senior citizen class for Kenner, and the little old people that are in the class, 80 and 90 years old, they're so funny and cute. And I'll ask them, what is the key to you getting around as well as you do? And they tell me, you gotta keep moving. The minute you stop, everything tightens up on you and it's hard to get it back.
And especially when you get to a retirement age where you don't have somewhere to go or something to do, you tend to just vegetate in front of the TV, and the movement, it just locks up.
Well, we lose muscle mass.
Right, quickly.
That's the first thing that goes. Yeah.
So, okay, so how long did it take to get 100% in Zumba after the lung but before the knee?
I would venture to say 4 months.
4 months. That's not bad, given that
4
they
months.
cracked ribs to get to it. And did you notice that when you first started, you said you started, you had an assistant.
Correct.
Who would so after you did the 5, 10, however many minutes of songs, you know, you that's what it was. Right. Yeah.
And I'll tell you, when it's extremely hot, like it is today, and when it's really, really cold, those are the times my lungs feel it the most. I get a little short, you know.
So you still feel that?
I do.
Yeah.
I do.
Because you've
I don't-
lost a third of that side of your lungs, the
Correct.
capacity of it.
Correct.
And that doesn't regenerate. I mean, it's not like your liver. It's not going to.
No, it don't.
not like a
grow
lizard's
another
tail.
one.
It's not gonna-
No,
right,
it
you're not
don't
gonna
grow
grow.
back. It don't grow back.
You know, and I remember we're also, full disclosure, we're part of a bunco group, and our group after this happened, Charlie, you know, was, because we do have some smokers in the group, and you know they would either go outside or something, and you know in the rules you can't get near cigarette smoke now.
No, I cannot. And the first words that my surgeon says when he walks into the room is, "Are you smoking?" And I'm like, "No, I haven't smoked in 10, 11 years, you know." But that's the first words he'll ask, because the minute someone does go back to smoking, you're no longer a patient of his. He wants nothing to do with you.
Well, look, sometimes I think that's what it takes, because people want to do what they want to do, and that's all there is to it. And it's like, look, don't waste my time. I've got patients who actually want to get better.
Yes.
So,
Yes.
all right. So on a parting note, now that your knee repair and a lung repair, and how do you feel overall? I mean, now that everything is on the mend.
I'm hoping that everything will stop hurting and I can get back to being me again, because
Oh, you're working. You're still doing hair. I mean, you did mine, so I
yeah.
know you're working.
Oh,
good.
yeah.
Right.
Yeah. And, you know, they asked me a question at physical therapy today. It said, how long can you stand on that leg, with the knee? And I'm thinking, 8 hours.
8 hours. Oh,
You know, and he looked at me like, huh? Most people are like, oh, an hour. I can only stay an hour. But, you know, I mean, sometimes I'm up 8 hours on this knee. So he did tell me, take a break. If you can ice it, you know.
because you don't want to go backwards. You
Right,
know, you don't
no,
wanna
he said
stay-
take
right.
care of it, you know. So I'm just hoping,
Well, and the fact that you were in good shape to begin with, you know, that always helps. I mean, you don't have to be a gym rat or anything, but
No,
if you
but-
eat well and you take care of your body, you know, and you have you don't have a sedentary job anyway. I mean, you're always on your feet, moving around, you know, with your arm. I mean, you must have shoulders like, you know, like Hercules after holding up scissors and dealing with hair for, how long have you been doing it? 30 years? 20 years?
42 years.
42 years. Man, you look good, man. You're doing something right with your secret. Checks in the mail, right? Is that it?
Yeah, it's the water I drink. Right.
So any last words for, you know, for the people? What can you tell people that might, you know, that might be going through this, even if it's not necessarily lung cancer, or, you know, it could be a joint problem or something? What do you tell them?
Take care of yourself. Take care of yourself. Do doctor visits on a regular. And if you can't exercise because of certain issues, walk. Walk. Sitting in front of the TV, move your feet, work your ankles, work your legs. Just move your body. Get some circulation in there.
Some movement,
and
any
move it.
movement is better than nothing at all.
Absolutely.
All right.
Absolutely.
Well, best of luck to you. Thank
Thank
you
you,
so
sir.
much.
Appreciate it. It's been a pleasure.
And we've got to get you back on here. This was fun.
Good deal. Thank you.
All right, that'll do it for another edition of Mission Fitness. Don't forget to follow us on Facebook and Instagram and subscribe to our YouTube channel. And we will see you next time. Thank you a lot.